Thank you very much. I'm Dr. Carl Chip Lavie, a non-invasive and preventative cardiologist in the United States in New Orleans, Louisiana. I just lectured at this course on exercise as medicine. I reviewed the data showing from Wen and colleagues in the 2011 Lancet of 450,000 people from Taiwan that showed that as you separated the low and the high physical activity, after the age of 60, the curves really diverged and you started to have significant protection. And they showed protection with just doing 15 minutes of exercise a day, and people all around the world love to hear that. There's been substantial evidence that one of the biggest things that exercise does is it improves cardiorespiratory fitness, how long you can run on a treadmill at what incline, and we define that in cardiology as METs, or metabolic equivalents. The higher the level of METs, the more you have protection against cardiovascular disease and all-cause mortality. And the best way to improve the METs is by regular physical activity, particularly some high-intensity physical activity. There is, of course, a genetic component of METs, so METs are not all coming from exercise. A major meta-analysis done just last year by Jari Luukkonen from Finland of 37 studies and 2.3 million participants showed that for every 1 MET improvement in physical fitness, or cardiorespiratory fitness, there was an 11% reduction in mortality. When they looked at the bottom third compared to the top third of levels of fitness, those in the top third had a 45% lower mortality. So exercise certainly is medicine. Peter Kokonos from the United States Veterans Cohort showed that regardless of age, even past age 80, regardless of race and ethnicity, regardless of gender, the higher level of fitness produced substantial improvements. There was even evidence that fitness was a significant predictor of getting cardiovascular and morbid complications from the COVID-19 pandemic. A lot of people will ask what dose of exercise you should do. Again, the Wen paper showed that the more and more high physical activity you did, you got protection, but only up to about 30 minutes per day. At moderate activity, you got protection at higher levels. We did a major running study published in JACC in 2014 of 55,000 people, 13,000 runners and 42,000 non-runners. And we showed the runners had a 30% reduction in mortality, a 45% reduction in cardiovascular mortality. But when we looked at the doses of running, we showed that the lowest dose runners, those who did less than 6 miles per week or less than 10 kilometers per week, those who ran just 1 to 2 times per week, 52 minutes per week or less, they got the same benefit on cardiovascular and all-cause mortality as did the highest dose runners. There was just a paper Monday in Journal of American College of Cardiology, and I wrote the editorial for that paper, that looked at the steps per day. Many people have thought that for years, 10,000 steps per day is the magic number to get protection. That came from a Japanese manufacturer of pedometers back in 1964. They showed in this paper, they analyzed 12 studies of 110,000 participants and showed that you started to get mortality reductions at just 2,500 steps per day and cardiovascular reduction at 2,700 steps per day. And you maximized out for mortality at 8,700 steps per day and for cardiovascular disease prevention at 7,100 steps per day. So well less than the 10,000 cut point. What all of this evidence is showing, even though we have guidelines to do 150 to 300 minutes per week of moderate physical activity or over 75 minutes per week of vigorous physical activity, it looks like the benefits from physical activity and exercise begin at much lower levels and may even maximize out at lower levels than the guidelines recommend. This should be comforting for clinicians advising patients all over the world on the benefits of physical activity, exercise, and improving fitness on health. So the answer is get up out the chair and move more, move throughout the day. Exercise, exercise, exercise. It's got tremendous benefit, and exercise is medicine. Thank you very much.